For part 4, Dr. Wise will present on self-care and competence. She will be joined by Tonya Omar, Susan Hurt, Stacy Jones, and also by Mark Davis, the board's investigator and psychologist. At the end of Dr. Wise's presentation, you will be asked to complete the knowledge check, as well as a survey about the training. Both the knowledge check and the survey must be completed to receive continuing education credit. The 3 hours of CEUs will be recorded automatically in the North Carolina Board's CEU register under your name. Thank you for attending.
Okay, I want to welcome everyone to part 4 of the supervision training. This one is going to focus on competence and self-care, and I'm very excited that we're going to have a chance to talk about this. We did talk a little bit in part 3 about how high-quality supervision can enhance self-care for supervisees, but we're also going to look a little bit at how high-quality supervision can really help buffer some of the challenges that are more unique to psychologists. For this section, we are joined by Mark Davis, who was not part of part 3, and so I'm going to ask him to introduce himself as we get started.
Sure. I'm Mark Davis, and I'm the staff psychologist and investigator for the board.
Well, welcome, Mark, and I'm really glad that you can be with us today.
Thank you.
So right before we started the recording, we were talking a little bit about how stressful these times are for our supervisees, for our clients, for our colleagues and ourselves, and really for all of us. And so I just sort of went through and made my own list of some of the recent stressors over the last 2+ years. And it really has been quite a time. And I think as psychologists, we both experience these situations just like everybody else, but we're also in that unique role of trying to help our clients. And as supervisors, we're also sort of have that third level of really trying to help frontline psychologists, LPAs, provisionally licensed applicants, sort of manage all of this in addition, their own reactions as well as their clients or patients. So I just think it's really important to not underestimate the context we're working in, and in some ways why this sort of training and a focus on self-care and competence is so particularly relevant right now. Each year, the American Psychological Association surveys people across the United States about stress, its sources, its intensity, and how people are responding to stressors, both mentally and physically. And they've been doing this since 2007. This is called the Stress in America survey. And I think it's a really great source of data on sort of general trends. But we have seen external factors really affecting stress levels. So this survey began, interestingly, right before the 2008 recession. But the 2020 survey was really where we started to reveal the impact of the COVID pandemic. And in previous years, all of the other stressors kind of remained, and this sort of got piled on top. And even before the pandemic, many researchers were talking, and public health specialists were talking about a mental health pandemic, and I think that has really intensified. I thought this data was really, really interesting for parents. And again, in a sort of intersectional way, many of our clients or patients are parents, many of our supervisees are, and many supervisors are as well. But I thought it was pretty striking that 75% of parents said that they could have used more support than they received. 32% were actually receiving treatment from a mental health professional, and 24% were diagnosed with a mental health disorder since the pandemic started. I think, sort of part of this, and I think it's affected all of us, who are parents in various ways. I don't have young children, but if you have young children, the long period of at-home schooling, remote schooling, and then daycare and schools that would just periodically shut down unexpectedly for weeks at a time. I think all of that, were sort of really serious sources of stress and distress for everyone. But, in this case, we're really thinking about how that intersects with supervision. The other piece, and this was the most recent survey, that 87% of the people surveyed across the United States say that they feel the last 2 years has been a constant stream of crises. And you can sort of look at this for yourself, the kind of world situation, the war in Ukraine, have really brought high levels of anxiety and stress. I thought this was also an interesting compilation that Liesl Bryant, who works with the Insurance Trust, put together. And these were news articles that sort of looked at this issue. Therapists are under strain, counseling clients on trauma that they're also experiencing themselves. I've certainly talked to colleagues who have lost family members or been sick themselves. And so I think this feels like one of those periods of time where the sort of outside events are impacting all of us. We're really part of the community. So even predating the COVID, these are across a lot of surveys, some common vulnerabilities for psychologists and other mental health professionals. And my guess is if you look at this list, there will be many that we can identify with. I think the one of professional isolation, again, this was from before the pandemic, but I think it speaks to the fact that many practices are, if you're an individual practice, if you don't have case conference time built in, it can be very isolating. And the pandemic has certainly intensified that. We talked about that a little bit in part 3 as well. I also included stage of life stressors. Some of the data is suggesting that our early career psychologists are experiencing an unprecedented debt load. And I know I needed to do some education of myself because I was able, which was much more common when I trained, to have my, have a stipend and have my graduate student education paid for, through doing teaching and research assistantships. That no longer is really applicable for the majority of people in training. So many of the individuals we supervise, especially early career, are going to have debt load as a significant stressor in their life. So what are some warning signs? These are, these are from research with psychologists and other mental health professionals, but they're pretty common. And these are certainly issues to be aware of for ourselves and for the people that we supervise. So for many years, the American Psychological Association has promulgated what the stress distress impairment continuum. And in their model, stress is both the internal and external sources of pressure that impact us on a daily or, sometimes not daily, but common basis. Distress is sort of how it makes us feel, kind of our emotional or physiological reactions to the pressures that we experience. An impairment refers to sort of non-adaptive changes that we make to our behavior. This might be things like failing to return calls in a timely manner, falling behind on clinical notes or billing, that sort of thing. And improper behavior refers to changes that might cause harm to clients or lead to ethical or legal violations, insurance fraud, sort of unacceptable relationships, sexual relationships with clients or patients, improper self-disclosures, issues that really can cause harm, or taking on work that we can't complete in a reasonable manner. That's really poor situations where we really are using poor judgment in a way, again, that can either harm ourselves or be likely to lead to a complaint. So this was a meme that I initially, I still think it's amusing. Wilson is now working from home, and it obviously shows a sheepdog trying to herd sheep on a desktop. But I think the part of it that is, is serious is if we think about this as a therapist or as a supervisor, We are really trying to manage some very, very, very complex situations in a way that we're not used to for many of us who are still doing remote practice. So I think about treating clients who have social anxiety or health anxiety, trying to do parent interaction training, trying to work with children or adolescents. I think this can sort of capture what it feels like. And I have heard many psychologists informally, and now there are some early surveys, saying that there's really a different kind of exhaustion that can occur from a full day of doing remote treatment. And that despite the fact that there have been some silver linings to working, if you're working at home, you have less commuting, you might have a more flexible kind of home schedule, but there is a very high level of exhaustion that can occur from this kind of work. And I think it's going to be a few years before we fully tally the costs and benefits of this sort of remote connection. I do think it has been, a remarkable benefit for many clients or patients who can, schedule sessions much more flexibly without transportation. People who, say, low-income clients who may not have access to transportation or whose work schedules are less flexible. So I think there are many benefits, but I also think we don't want to sort of underestimate the potential challenges. And I think it's something that as a supervisor, both in your own practice, but also with your supervisees, is to sort of think about how people are setting up their days. So I know this is a text-heavy slide, but I did want to include this for some context. So these are some places I found, and I'm not saying that they're the only places, but where our Psychology Practice Act directly looks at issues of practice when we may be sort of cycling down in that stress to stress impairment continuum that we just looked at. Under the Code of Conduct, number 10 looks at unprofessional or unethical conduct. Number 11 is where we might have endangered the welfare of clients or patients. And then 12 is maybe especially applicable. And I'll just read that quickly because I think it's so important, where you've demonstrated an inability to practice within reasonable skill and safety by reason of illness, inebriation, misuse of drugs, narcotics, alcohol, chemicals, or any other substance affecting mental or physical functioning as a result of any mental or physical condition. So I think this one does speak to our responsibility, again, to, if we put it in the positive, to practice psychology with reasonable and skill and safety. So I think that sets kind of a pretty clear expectation for our behavior. So if we think about this in this ethics code, in general principle A, which is aspirational, it reminds us that psychologists strive to be aware of the possible effects of their own physical and mental health on their ability to help those with whom they work. So I think that's a kind of a broad vision. In the standards, a couple that are specifically relevant are that we take ongoing efforts to develop and maintain our competence. In the context of the current ethics code, I think the ongoing efforts are generally assumed to mean sort of staying up to date in our technical skills. I think I've done some writing on this and other colleagues have as well, that I think our ongoing efforts really should include connecting to colleagues. We've talked about that in part 3, the importance of being part of consultation groups and working with colleagues. But also I think ongoing efforts, I think, should relate to our own mental wellness as well. 206 is interesting. This looks at what we are expected to do when personal problems and conflicts might impact our work. I put an emphasis here when psychologists know or should know, and should know is a little bit legalistic, but I think it does speak to the fact that kind of the standard is what a reasonable person would know. So the fact that we're kind of oblivious of a major downward spiral is not going to really be a lot of protection for us if there's a complaint, and really any reasonable person would have known that it was not okay to keep working or keep trying to do what you were doing if you could not function. 206 looks at what you do when you become aware of it, and we'll look at this in one of our vignettes. I think I have talked about this with many graduate students and done a lot of CE workshops, actually throughout the United States and Canada, and nobody finds it easy to take time off. If you're in private practice, there are direct economic impacts. If you're in an academic or an agency setting, the work that psychologists do, I think it is important, and it will almost always impact somebody if you take time off. And so I think what I encourage people to think about, and I would encourage, we talked a little bit in part 3 about one role of supervision can be to help supervisees think about their settings and how it impacts them, good ongoing self-care can be very helpful, but also there are things that can happen in any of our lives, illnesses in ourselves or in loved ones, that may really mean we have to take some time off. And so to the extent that we can build that into our work settings, you have a little bit of flexibility, that's an awesome thing. And if you can't, then you still need to be very thoughtful and proactive about what to do. And I think especially, I think we've sort of started talking about post-pandemic, but I think it's clear right at this point in time, numbers are starting to go up again. I think we're going to be in this for a while, and it's a worthwhile conversation to have some flexibility with our work if we possibly can. So I thought this was kind of interesting. 2 surveys, and were done 30 years apart. The first one by Pope Tabachnik and Keith Spiegel in 1987 has been cited many times. They asked many questions of psychologists about ethical standards and whether or not they applied them in their own lives. And one of the areas of discrepancy was that psychologists commonly acknowledged working when they were too distressed to be effective. That was in 1987. And Becca Schwartz-Mehta and Dave Shenmiller, 2 good friends and colleagues, in 2018, they replicated that study, and they found, although ethical behavior in many other areas had improved, awareness of harmful multiple relationships and so forth, or the importance of not signing insurance forms that for work you didn't do and that kind of thing, psychologists were much savvier, but this question had not shown much improvement. So I thought that was kind of interesting. So we talked a little bit in part 3 about the importance of colleagues, and I thought I would just introduce here in a slightly more formal way a definition of competence constellation. This is from Brad Johnson and his colleagues. So this is communitarian ethics, which is sort of the role of communities and ethics, that you can't really take those apart. And I'll let you read this. This is sort of the formal definition. But I really like this. It sort of suggests that we have many different ways that others can be part of our networks. And I think supervision certainly is part of this. When there's formal or required supervision, I think it's critical in training programs, that role of mentoring of supervisors. So I think this is really important. I wanted to share, these are a couple of ideas that this group has encouraged adding to the ethics code. So under the one where we talked about maintaining ongoing efforts, they're encouraging to add to this, part of our ongoing efforts is to maintain regular engagement and solicit feedback. And when we looked under 206, personal problems and conflicts, there was the A and B we looked at, but C was also a very different kind of potential expectation. This is not in the ethics code, but they're encouraging it. And the ethics code, as you all may know, is currently going under revision. But that sort of how we act to each other when we're concerned about competence, and that we offer care and support and collaborate and help our colleagues, sort of figure out what they might need to do to address whatever problems or conflicts they're experiencing. So back to the stress-distress continuum. One of the first articles that I wrote actually was a bit of a critique of this model, which I think is good as it stands. But when you look at this, there really is something missing. As psychologists, we kind of first conceptualized positive psychology and really encouraged looking beyond mental illness to also consider well-being and health. So when I sort of look at this now with some humor, it kind of is suggesting that the very best we can do as a profession is try to stay at being stressed and not spiral all the way down into improper behavior. I almost have this image of like hanging on a cliff, trying not to slip all the way down. And so we're not going to spend a lot of time on this today because it's a little bit of a different, sort of a different path than we're focusing on, but it's something that I enjoy teaching about in classes and workshops. But thinking about what a top end or upper end of that continuum would look like: self-care, wellness, competence, and flourishing. These elements, the 6 that I put up here, are from SAMHSA. There's many different kinds of versions of this, but I think it is really fun to think about, like, again, what would our practice look like for it to truly be sustainable and joyful? And I think high quality supervision can really be an element of that, not just for supervisees, but also for supervisors, because of the opportunity to connect and to really promote best practices. So I'm just going to share a couple of ideas. Ellen Baker has I think a very nice conceptualization of self-care. She started writing about this in 2003. She's one of the earlier psychologists that I'm aware of who really conceptualized this. But she has 3 elements: self-awareness, self-regulation, and balancing. And interesting, even though she's calling this self-care, she sees balancing our connections to self, others, and the larger community as an element of self-care. One more conceptualization I'll share, which I have become increasingly enamored of and have been really encouraging teaching this to clients or patients, and recently incorporated this idea into a college thriving course that we're developing at UNC Chapel Hill. Kristen Neff has been doing work on this, and she has done a lot of evidence-based work at looking at self-compassion as closely associated with many other markers of well-being and high functioning. So self-kindness probably is the one that many of us think about with self-compassion, just being kind and understanding to ourselves when we experience pain or failure versus being harshly self-critical. Common humanity, I think, is a really powerful one. I think especially in the context of the pandemic, social isolation has been much higher, and a reminder that we're part of the larger human experience versus separating and isolating. And we know, again, even before the pandemic, isolation and loneliness were arguably their own pandemic, with very, very severe and negative outcomes, both for emotional health, but also for physical health. Especially, it's a very, very important issue for as we age. And mindfulness is her 3rd one, which is holding painful thoughts and feelings in balanced awareness rather than over-identifying with them. I know this seems, these are kind of fairly high-level conceptual ideas, but I have been struck that college freshmen and graduate students, and certainly our colleagues, really can remember, these are kind of understandable and really very applicable and powerful. So this is these are a list of self-care strategies that John Norcross and Gary Vandenbos have promulgated. Their book, this is from a book called Leaving It at the Office. And what's kind of cool about this is they were writing this specifically for psychologists who are in private practice. And so if you look at this, I think you'll see many of the issues that we covered. And I'll just mention a couple of these that I think are really helpful. I think refocusing on the rewards. So, after a tough day, and it really is exhausting, many areas of practice, to think about, sort of the ways, like, what did we find really important? Was it connecting with someone? Was it when a client or patient really got an idea, or a parent got some support and left feeling sort of a higher sense of sort of confidence than when they came in? They also really recommend looking at our environments. I think if you are working at home, if you can create a comfortable environment for yourself, that can be really powerful. I think cultivating spirituality and mission, you know, whether you're able to do that in your work or in a related way, I think that's wonderful. And something about, you know, I think careers in psychology is that we do have some opportunities to foster creativity and growth in what we do. You could do, you know, consulting at a school. There's lots. I mean, I think psychology is just so needed now that there may be many opportunities to just, you know, diversify a little bit what you do in your day-to-day work. So those are kind of my pitches on self-care, but I think they can be very much integrated into supervision. Okay, so I'm gonna just, let's see. You know what? Sorry. Okay, so we're going to look at our first vignette, and I'm going to kind of turn it over to our discussants to answer, you know, to sort of share their reactions, answer the questions. You're also welcome if there are questions that you want to answer that I didn't think to ask, that's fine as well. So I'll kind of turn it over. And as we did in part 3, I think we're a small enough group, we can do this kind of informally. So I don't think we need to raise hands, but we can just sort of have it be a conversation.
Well, I think for me, this vignette really raises the concept of a continuum. I would have said in 2 ways, and now with the stress, distress, impairment, problematic model, probably 3 ways, because the first part of this, and the first kind of continuum for me, it really pulls for my kind of belief in the developmental model, because by the time you're a provisionally licensed psychologist, you're a knowledgeable and experienced person. And so the supervisee is both a knowledgeable, experienced person with a developed skill set. And I think at this particular point in training, which is the very last bit of it, because this is the postdoc year, if I'm reading this right. And I think at that point, there's really room. It's a transitional period from training to practice, and there's really room for frankness and openness and transparency. And so this is, to me, this is a good opportunity for the supervisor and supervisee, just as a one more experienced and one less experienced colleague, to really talk about the balancing of life stressors with practice needs. And even starting with, if this is the first time this ever happened to you, that you had this much work to get done and something blew up in your life, and it won't be the last time, and just kind of some frank practice discussion. But then as you keep reading it, and I guess because the other continuum is kind of the normal life balancing that we all have to do, because nobody's in perfect shape for most of their therapy sessions, and nobody's in perfect shape for most of their supervision sessions, and some of it I think can end up being valuable to the experience, and then of course somewhere else on the continuum damaging. So that's the question for me, is when you get to exhaustion and not being able to focus and concentrate, are you moving further down the distress modeling and getting concerned for some more self-care, caregiving, you know, a different kind of consultation? So for me, I'll just say in general, this whole thing just raises where you are on a continuum, and it kind of helps inform directions to go.
I agree. And I think this is a really good learning opportunity for the supervisee to, like you were saying, Susan, they're kind of early on in their training. And I think that especially as psychologists early on, we're trying to do a very good job. We're trying to please. We're trying to do basically everything we can with the amount of time that we have. And sometimes we're not always as great at setting boundaries and taking care of ourselves, because if you don't take care of yourself, you can't take care of your clients. And this may be one of those conversations that has to be had between the supervisor and the supervisee to say, okay, where are we here? Is this at, past the distress area? Is this a situation where a boundary needs to be made? And that it's okay sometimes to cancel an appointment if you need to take care of yourself, because potentially the services you may be providing could be deficient and could be unethical. And so this is a good conversation to have, and I think it would allow the supervisor to sort of determine too what the recommendation would be or what their guidance would be in this moment for the supervisee, and trying to really get an idea about where they're at on that scale. Have they progressed to the point that their practice could be potentially impaired?
I completely agree with Mark. When I saw this immediately, I thought, okay, so the work is to definitely let the supervisee express whatever the things is that they need to express, but the work then becomes to look at the caseload and decide per consumer, what is it that we need to do? And as Mark is saying, there's always an opportunity to figure out another solution for a client if you're not able to see them. And that's what supervisors are there for, to help you figure out, okay, what do I do with this caseload when I have a personal thing that will not allow me to perform? So I agree.
Right, and canceling an appointment or rescheduling, or if there's an emergent situation, having another clinician assist, all those things are not client abandonment. They're coming up with a plan about how to deal with that situation and best care for your clients, which is one of the most ethical things you can do, really.
That's right.
Something I was thinking about, which I was not aware when this was sort of a kind of de-identified compilation of sort of either situations I've had as a supervisor or heard about. But, one place to also think about, as a supervisor, this would not feel like, yay, I'm glad this is, that this has come to me, because it's kind of stressful for us too. We're kind of brought into this in a way. But nonetheless, drawing a little bit from DBT, one place to genuinely sort of that I would want to be able to take as a position for myself as a supervisor would be to be able to say, I am so glad you're telling me about this, because it would not be impossible that a supervisee might just kind of try to power through this and not share it. So, one place to start is, I'm glad you trusted me enough to tell me about what's happening with your family and how it's impacting you. And then sort of picking up on what people have already said, this gives us a chance to kind of work through this together. And, there are many, many absolute rules in the Ethics Code and in the Practice Act. I think this is kind of more of a, sort of more in the area of professional judgment, like sort of having a way that you think through. I mean, I think my recommendation would lean towards encouraging some rescheduling of clients, or at least some clients, as Tanya said, some might be okay, some not okay. There may be nights, it's not just that we didn't get enough, that the supervisee didn't get enough sleep, but I think it's their level of distress and distraction that might really make it hard for them to be present. And interestingly, something else, sometimes there's sort of levels of vignettes that are kind of interesting. As you all were talking, I was sort of thinking about, is there even some parallel between the supervisee's role in her family of maybe being a bit of a caretaker, becoming a psychologist, and then maybe even what's making this situation a little bit more challenging, like that, it's not a natural thing to say there's some limits to what I can do, whether it's for the family situation or to the professional role as working with clients or patients. So, yeah.
Yeah, I agree, Erica. I think that there's definitely a lot of overlap between individuals who are caretakers in their personal life and then moving into a field like this. But in both those areas, both the personal and the professional life, setting those boundaries and having an idea about what your limits are, can be is going to be necessary, but is going to be very healthy for everyone involved, in order to make sure that you're doing a good job, clients are taken care of, your family's taken care of, whoever it is.
Mm-hmm. Any final comments on this vignette? Okay. Well, I think we've covered, covered most of the questions that I had. I guess if you were a colleague of the supervisor and the supervisor had consulted you, I think we've probably also kind of covered that as well. You know, that I think we would encourage the supervisor to welcome, you know, being asked about this and maybe use it as not just an opportunity to make a decision in this situation, but also to think more broadly about limits and professional responsibilities. I think as Susan and others mentioned, this exact situation may not occur again, but I think there's many ways that situations like this happen, whether it's, you know, if we have children, families, you know, we don't, you know, 206 does not tell us that we have to cancel all of our professional work if we, you know, get 7 hours of sleep instead of 8, but it does tell us that we really have to be mindful of our ability to function in a at least reasonably effective way. So, okay, thank you. We'll go on to the next vignette, let's see, which is a distress supervisor. And there'll be a, you know, a pause in the presentation for people watching it to read. So I think we can kind of start our discussion at any time.
You know, I read this, and as the supervisee, I'm feeling some distress myself now because I have a need, and it's increasingly pressing because we didn't address it, you know, in our previous session, and I would definitely want to be, I think at this point, expressing that need, and when could we reschedule, you know, sooner rather than later. And when I think about I'm doing quarterly supervision, it feels even, you know, more pressing to address this sooner than later. And potentially, I'm really thinking, looking backwards, maybe I should have rescheduled that first time. You know, after I put out there that this is all that's going on with me personally, and we haven't even gotten to what I need to discuss professionally, that would have been a good time for me to say, and this is pretty important, so can we schedule something sooner than our next session?
Yeah, one of the things that occurred to me in reading this is, so the first vignette we had was a distressed clinician, which directly affected clients. And here we have a distressed supervisor, which most directly affects the supervisee. And one of the things that occurred to me, and it's kind of a shame, like on the one hand, I don't think our supervisees have the same vulnerability about a bad or disappointing supervision session as our clients do about a bad therapy session. Like, a lot more harm can be done at a bad therapy session than would typically be done in a problematic supervision session. On the other hand, though, our supervisees really have a lot at risk for a session not counting, because it's a contract with the board and we have no provisions for substitute supervision or a substitute supervisor. So I would think, from a supervisee's point of view, as bad as it is, they might rather meet the requirement of the supervision with a crappy supervisor than be in the position of not complying with that contract that requires it. If it's at the end of the week, at the end of the month, or at the end of a quarter, you just got to get it done. I mean, there's pressure to just get it done to stay in compliance. So it can be really problematic.
Now, as hard as it may be in this scenario, it would be the supervisee's turn to ask the question, hey, will we be able to continue supervision? Because I really need it. And then they would have to make that judgment call, because the way it sounds like no, because they're not even willing to hear the cases. And unfortunately, changes might have to be made, even if it's temporary.
Yeah, I think the supervisee has to advocate for themselves here because, like Susan, and I think Tony was saying too, is that that they have a responsibility to uphold for themselves, for their clients, and for the the agreement with the board in order to get the supervision that's required, to get the supervision that they need in order to effectively provide the treatment that they're providing. So yeah, I think they have to advocate for themselves, and they have to be somewhat confrontational, even though they've been working together for a long time. So hopefully they have a pretty close working relationship. I mean, 2 years is a good long time to be meeting regularly like that. So you've probably got a certain amount of comfort, but going both ways, that you can have this conversation, regarding what does the supervisor need at this point, and what does the supervisee need to do to get their needs and requirements met.
Yeah,
Mark, I think you bring up a really good point. It's high quality supervision. Our topic is for the supervisor to provide high quality supervision. And I think it's important for the supervisor to kind of put that out there in the beginning, to put some responsibility on the supervisee to say, let me know what you need to meet the definition of high quality supervision. And as that supervisee relationship develops over time, is to not lose sight of that. That this is high quality supervision. And as a supervisee, I have a responsibility. And as a supervisor, I have a responsibility to remind my supervisee of that. And we develop that in our years, so that when we get to the receiving quarterly supervision, it is such that we know that we can ask for and expect to get what we need outside of the parameters of our once a quarter.
Yeah, I love that view, because I think that makes it, which it really is, kind of a joint a shared responsibility to keep an eye on that. And in some ways, this vignette was written in a maybe fairly extreme on the part of the supervisor's behavior. But I think when people get under a lot of stress, it is easy to lose sight of kind of, our own needs can feel so pressing that it's easy to sort of lose sight of other responsibilities. And I think the fact that the supervisor is under a lot of stress with her family situation does, that there still is a professional obligation, even if not to provide the supervision maybe at that moment, but to be planful and open to discussing, well, then what will we do instead? If I can't be available right now, can we schedule another time? Or to have, because I think, and I do think that these are, kind of fit under, kind of beyond what we can talk about today, but I think this whole idea of difficult conversations, how do we bring up when we are concerned about someone else's behavior and how it's either impacting us or our ability to get our work done. This is really an opportunity to have those conversations. And I think it's having it before before problems arise is really ideal, because then you've laid some groundwork. Like, remember when we discussed that I would let you know if things, were not working for me as a supervisee? Well, this is one of those times, and to be able to have that conversation. And I assume, that in addition to maybe the supervisee being able to consult with their colleagues, if there really was a question, this is something that Mark, you or someone else at the board might even be available to say, this is happening. What are my options?
Exactly. Yeah. I mean, because the board's always a resource for that. But if you've explored, hopefully, again, you have a good working relationship, you can have that conversation, you can address those needs. But there is a point that it goes to where you're not getting the supervision you need. You may not be meeting the requirements of the board, and you may need assistance or intervention by the board to assist in that process as a supervisee. And I guess the supervisors need to know that that's a potential, that could happen. So it's one of the reasons to stay on your toes, because I think with something like supervision, especially if it's routine, it gets comfortable. But it's one of the things that's going to slip when you have more pressure on you, when you have more stress on you, when you have all these more intense things that is taking a lot of your attention and energy. The more routine things, the things that have become comfortable, are the most likely to slip. And so that's one of the things I think as a supervisor, you just sort of have to manage that and think about this responsibility just like all the other professional responsibilities you have.
I think that's a great point because, again, if you have, for a supervisor, if you have a very competent supervisee who comes for supervision, but generally has been managing things well, I could see it might be tempting to think, well, it's sort of okay for me to lessen my attention in that area. And, that maybe even this workshop can serve as a reminder that that supervisors have a direct agreement with the board, and really this is a professional obligation that is with the board for what their role will be and how they will do it and what they will be providing. So it's not an optional, flexible kind of arrangement. So good. Well, I think we are about to wrap up this segment. Any final comments, questions from anyone?
Well, I'll just add one more little point to this distress supervisor vignette is that, when you add the 20 minutes late and the preoccupation and what have you, it's possible that, I don't know, if I were the supervisee, I would want to know if the supervisor's having the same behaviors with clients.
Mm.
Yeah. Just upping the ante, like a bad supervision. So like I was saying, I think there's less vulnerability for a bad supervision session. It can be fixed, it can be made up, it can be rescheduled. But if you're seeing evidence of impairment, then there's the gate. We said the gatekeeping role is a two-way street. So.
Yeah, I think you're raising, this can raise some complicated issues. I think reminding that it is a two-way street for both supervisors and supervisees. So, well, thank you. And I know we ended sort of looking at the challenging end of the continuum, but I also think, as we've talked about how when supervision is going well, which I think it is much of the time, it really is also a source of of adding positive energy for both parties. So I think, it can be on that whole continuum, but we did want to look at sort of some of the challenges, because I think that fits within this, the goal of this workshop. But again, remembering that it kind of serves purposes throughout that whole continuum of functioning. So, well, thank you again to the participants for being willing to be part of this, and happy supervising going forward.